Hi. Now I'm going to explain very important aspects of OET writing, that is when to use capitalization and when not to use capitalization. I hope this is the doubt for many people, and that's why in this video we are going to clearly tell where to use and where not to use. Let's begin. The capitalization is the writing of a word with the first letter in uppercase and the remaining letter in the lowercase. I hope you clearly understand what you mean by uppercase. Uppercase is just capital words, and lowercase is not the capital words. And when do we use the capital letters and why do we use that? Capitalize the first word of a sentence and the first word after a period. Here, the period means full stop. So it's very important, it's a very basic thing that you always capitalize the first word of a sentence, and also when you put a full stop, again, when you begin a sentence, you will start with a capital uh, word. That's a very common thing. And capitalize titles when they are used before nouns. For example, Mr. Gerald Baker, Miss Cindy Show. So again, when you write the name, you have to use the capitalization for sure. The next thing is about you use the capitalization in order to mention races, nationalities, tribes. For example, Eskimos, Japanese, Aboriginals. So in this, either it is a nationalities or races. That's why we use the capitalization. Then of course we have to capitalize countries and languages. For example, India, I should always be capital. Japan, J should always be capital. Australia, A should always be capital. English, E should be capital. Hindi, H should be capital all the time. Next thing is the medicines. I think this is the very common problem people face as far as medicine or medications are concerned, when to use the capitalization and when not to use. For that, we are just explaining that very clearly. Brand names require to start with the capital letters. Again, what is the brand name? Brand name is just a name given from the company. For example, Augmentin. Augmentin is a combination of amoxicillin and clownic acid. So uh, together we call that as Augmentin. Lasix. Lasix is just the name of one company for the medication called furosemide. So Panadine Forte, again, it is a painkiller and which might contain paracetamol and some codeine, or uh, paracetamol and diclofenac, something like that, which would be called as Panadine Forte. And these brand names are given by the company and they're not the content actually. So we use capitalization for those things. And again, holidays, months, days, all these things will require capitalization. So Mr. X will return on Christmas Day. Christmas is a special day, and that's why we use that with the capitalization. He was admitted to hospital on January 12th. J should be capital. A chest X-ray was taken on Wednesday, and again W should be capital. And some of the medical conditions which are named after the person. Of course, let's go back and just see that mm, medical thing again a little. So I said that brand names require capital letters, but at the same time, if it is the content very clearly, then they wouldn't require capitalization. For example, if you want to write penicillin, and then that is the content of the medicine, so you don't need the capitalization. Again, Augmentin, A should be capital. If you want to write amoxicillin, you don't need to write capitalization. If you want to write Lasix, Lasix is the name given by the company, so that it's a brand name and you need a capitalization. But if at all, if you want to write the content of Lasix, which is furosemide, you don't have to write capitalization. So F should be small letter. And Panadine Forte, it is the company name. If you would like to write paracetamol, then again uh, it should be small letter. And again, there are a lot many people who are confused with this itself, like how do we know which is a brand name or not. I think for that, what we recommend is, even if you use the brand name or if you use the content name, in any case sometimes it could be considered as a as a proper noun. And again, proper noun should require capitalization. That's why if you're so much confused about brand names and the content names, so go with the capitalization, which we recommend. However, it is always recommended and it is always advised to know what is brand name and what is the content of those brand names, or you know those drugs. It's better. Next, medical conditions which are named after the person who discovered it, or it is associated with the treatment, are capitalized. I think if you know it, Parkinson disease. This is the disease which actually discovered by somebody called Parkinson, and that's why P should be capital. Alzheimer, again, it is the disease which is discovered by somebody called Alzheimer, and that's why it is called Alzheimer's disease, and it should be A should be capital. Crohn's disease, C should be capital. Down syndrome, D should be capital. If at all, if you want to write diabetic mellitus, then you don't need capitalization. If you want to write hypertension, you don't need to have capitalization. If you want to write hypothyroidism, you don't need that. If you want to write osteoarthritis, you don't need capitalization very clearly. For the medical condition which comes with the name of the person who discovered it, only require capitalization and nowhere else. And again, the pronoun I should always be capitalized. It's, you just remember, regardless the placement of I, it is always capital. We cannot write I as a small letter anywhere, so it's always capital, whether it is in the start of the sentence or whether it is in the middle of the sentence. I'm writing this letter, I should be capital. It was I who treated the patient, again I will remain capital. The next thing is job titles must require capitalization. The job titles, in the sense, the designations, and the lactation consultant, that is, of course, should be written with the capitalization. The community health nurse, the charge nurse, uh, you know, diabetic specialist nurse, all those things which should come with capitalization. And we need to capitalize place, name of the hospital, and institutions. If you want to write just a hospital, you don't need to capitalize. But if you want to write the exact name of the hospital, for example, St. John's Hospital, then of course that has to be with the capitalization. But if you want to write simply he was admitted to hospital, then you don't need the capital. But if you want to write the name of the hospital, of course you need it. He was admitted to hospital, then H is small letter. If you want to write he was admitted to Victoria Hospital, then V and H will remain capital, because that is Victoria Hospital is the name of the hospital, and that's called proper noun as well. Mr. X studies at University of London. Again, University of London is the place of that university. I mean, it's a name of that university, so of course that has to have a capitalization. Then we have to capitalize address and other place names such as cities and towns. For example, 22 Main Road, Newtown. And this usually you write in the reference, or you write these things while writing the reader's address, before introduction in OET writing. At that time, of course, you should maintain the capitalization for these things. Also, please capitalize first word of a salutation and the first word of a complimentary clause. Rather, we'll go to the examples. Dear Dr. Jameson, yours sincerely. Y will remain capital, yes will not be capital, just be careful about that. Dear sir or madam, D will remain capital, yes will remain capital, M will remain capital. Yours faithfully, Y only will remain capital, and F will not be capitalized. So this is the usual way to use the capitalization in OET writing. Then again, as we said before, where we should not use the capitalization that we have mentioned here, generic drug names do not need to start with a capital letter. For example, Ramipril, aspirin, penicillin, and some more if you want to, amoxicillin, clownic acid, paracetamol. All those things would not require capitalization. And of course, names of the disease which should always be lowercase. For example, as I mentioned before, diabetes, hypertension, deep vein thrombosis, dementia. And if at all, if the person who discovered the disease, then it comes with the name of them, of course it need capitalization. Then we have something called nouns, which do not specifying any institution, place, or person or profession, must be in lowercase as well. He was admitted to hospital, no capitalization anywhere other than the start of the sentence. She does not have a family doctor, no need of capitalization. He was referred to a gastroenterologist who we don't know who is that gastroenterologist, but if any specific name is there, then we should write that in the capitalization. If not, we don't need it. Names of the medical procedures do not require capitalization. For example, X-ray, total hip replacement, echo, ultrasound. And again, body parts should be in lowercase as well. For example, head, heart attack, appendix, knee, elbow, everything should be in lowercase as well. And that is the end of capitalization. I hope you understand when to use capitalization and when not to use capitalization. If you have any queries, just feel free to ask us and clear your doubts. I hope this will help you out. Thank you so much.